Just finished with the NYU Fight Medicine course. It was just a one-day thing. You can see a couple things, a couple of pearls that I've been posting. Really interesting stuff, so I wanted to talk about some things for you PTs that are watching. There was a big emphasis on concussion, obviously that being a huge issue with any sort of mixed martial arts sports. And it really is important that we as PTs know how to screen post. We're not talking about fighters that are professional fighters or even amateur fighters. We're also talking about people who are sparring with other people that don't know how to spar. Okay, sparring is not supposed to be heavy all the time. But everyone who has sparred will eventually spar with somebody and take a big headshot and maybe not feel as great. And it's really important that you understand that and ask your fighters about that and are able to screen that. Another interesting topic was about female fighters and how there are some differences that you see with male fighters. One of those differences is temperature regulation. Pre-fight, to have a colder room for a female fighter actually puts them at a disadvantage. Shivering for females is not as effective as it is. Another interesting thing was actually the type of mats that are used, and I had a little something to say about that because I really think the type of mats that are used in a Muay Thai gym versus a BJJ gym can make a really big difference for a Muay Thai fighter's knees. When a Muay Thai fighter pivots to kick, if that mat is a little sticky, it will cause a rotation at the knee instead of at the hip, which overall, or I should say repetitive motion of that, can lead to a sprain of your MCL and even a meniscal. Another important thing that was talked about was the fact that there is no off-season in mixed martial arts, and we really have to take that into account when treating our patients, because you can't tell someone to stop or to stop training, but you can help them modify training. You can help them with scheduling so that in a way they do have an off-season, they do have a pre-season as well. And last but not least, let's also be aware of these, or take into account sports psychology, even with injuries. A lot of times with what we know about pain science, fighters who have these ongoing injuries will also have negative thoughts surrounding those injuries that may contribute to increased pain. So I guess let's keep a positive attitude and be safe.